bienvenue à tous et à toutes. Welcome here to CHEO, and welcome streaming live on Facebook, many members of the National Newcomer Navigation Network, all through, oh, well, there you go. There they are, some of them all through the country. I'd like to especially welcome our special guests. I never really welcome Marie-France Lalonde. I always say welcome back because her very first job out of social work school was here at CHEO. So welcome back to our CHEO alumnus, former colleague Marie-France Lalonde, of course, the Member of Parliament for Ottawa Orleans and now Parliamentary Secretary to the Honourable Sean Fraser. Our local MP in Ottawa South, David McGuinty, whose mother, of course, was a CHEO nurse, and most of the members of your family, I'm not sure you were ever able to get a job here. Yes, you too, good. Yeah, it's a very inclusive workplace. And Yasser Naqvi, of course, the MP for Ottawa Centre, and a CHEO dad, and has often spoken about that. So it's really great to be with these amazing friends of CHEO who are our elected representatives in this region. And of course, to get started, as we always do at important gatherings, this is an important gathering, is to acknowledge that Ottawa is built on the unceded territory of the Algonquin Anishinaabe people, who have been the stewards of this land since time immemorial. And we honor their stewardship, past, present, and future, just as we honor all Inuit, Métis, and First Nations people. Now, I believe that Parliamentary Secretary Lalonde has some good news for us, and you know, when you invite somebody over for dinner, you don't eat their meal for them. So I'm going to ask Marie-France to come forward and share the exciting news with you this morning.
Merci beaucoup, Alex. C'est vraiment un plaisir d'être ici comme alumni avec vous aujourd'hui. And also with all of you from CHEO. I would like to invite maybe my two colleagues, Yasser and David, to come up front because this is a great announcement for the National Capital Region and certainly for all of us. It is truthfully a pleasure to be here to represent the Honourable Sean Fraser, Minister of Immigration, Refugee and Citizenship. And as I mentioned, I am joined with two fantastic colleagues of mine, David and Yasser, and also, I have to say, a great supporter of CHEO, but also from the NCR caucus. Et comme Alex disait, en tant qu'ancienne travailleuse sociale qui a travaillé ici à CHEO, mais maintenant représentante élue, je suis très consciente du rôle immense que joue le Centre hospitalier pour enfants de l'Est de l'Ontario dans cette région, et notamment pour soutenir le réseau national de navigation pour nos nouveaux arrivants, le N4. When it comes to welcoming newcomers to Canada, it's not enough to just get the people here. We also have to ensure that they are set up for success once they arrive. C'est pourquoi nous avons besoin de projets novateurs comme le N4, une initiative qui permet de mettre en relation et de soutenir ceux d'entre vous qui aident ces nouveaux arrivants à s'établir. So today, it is with great pleasure that I announce a one-year extension of funding totaling just about $1.5 million to further support the work of the N4. This... we should? Congratulations. This one-year extension of funding will broaden this incredible important work. Specifically, it will allow the network to help address the many vacant positions in the healthcare sector, but providing the information and the resources to match internationally educated healthcare professionals with these vital jobs across Canada. Comme vous êtes nombreux à le savoir, le réseau offre aux membres un accès à des outils technologiques tels qu'un programme éducatif en ligne, des liens vers des activités et des ressources professionnelles et une communauté de pratiques qui permet aux praticiens en soins de santé et d'autres secteurs d'échanger et de discuter de leur travail. Professionals using N4 applauded, saying it has deepened their awareness of the healthcare challenges newcomers face. Imagine leaving your country of origin, coming to Canada, and having to adapt to new ways, in particular, a new healthcare system. Or being uncertain whether all of your healthcare services are paid for. Or not having French or English as your first language and having your children serve as interpreters. People working at places like CHEO regularly witness such situations and work to address them. And I hope they may benefit from the opportunity to share these experiences with colleagues and discuss possible solutions. I should note that N4 is also producing promising results. To assist those working with Afghan refugees, an N4 working group is collecting and curating resources for a toolkit that will provide information specific to Afghan newcomers on cultural awareness, language, LGBTQ2+ issues, and physical or mental health challenges. To help those who work with newcomers patients, N4 raises awareness related to factors such as trauma and financial hardship, concerns that may prevent newcomers from seeking medical help or cause them to miss medical appointments. Et enfin, afin d'éviter que les enfants dont les parents sont de nouveaux arrivants aident à servir d'interprètes pour les adultes lors de leurs rendez-vous médicaux, le N4 sert à élaborer des recommandations sur l'offre de services d'interprétation professionnelle aux nouveaux arrivants qui ont recours aux services de santé et aux services sociaux. Canada has a proud history of opening its door to newcomers, individuals who have propelled our economy or strengthened our communities. Et en prolongeant notre investissement dans le projet comme le N4, nous continuerons d'accueillir de nouveaux arrivants et d'investir en eux afin qu'ils puissent contribuer à bâtir un Canada plus fort et plus dynamique qui fait preuve de compassion. Thank you all for the work that you do and for inviting me here today. And I have to say, as we are still having a pandemic, I want to, on behalf of all of us, say thank you for all the hard work that our healthcare professional, CHEO, has contributed in helping us minimize the impact of COVID here in our national capital. So merci beaucoup pour tous vos soins. Merci beaucoup.
Merci, merci Marie-France pour cette annonce et pour votre appui et l'appui de tous les députés de la région pour le travail que nous faisons ici au CHEO. As Marie-France mentioned, when the Syrian refugees started arriving here in Ottawa, of course, 60% were children. And they started coming to CHEO. We weren't doing a very good job. We were not ready for them. And as Marie-France has pointed out, anytime a parent brings a child to the hospital, it's a scary situation. It's a difficult time. And to do so in a new country, not knowing the language, not knowing the processes, was even tougher. And so our staff quickly mobilized. They saw a problem, and they worked to find a solution. And they created a Navigator program. And thank you, Christine and Zahar, for your leadership. They created a Navigator program here that ultimately then we scaled up and took the learnings national and built this national network, the N4, that really seeks to make sure that when newcomers arrive in a hospital or other healthcare setting, that they receive the care they need and they receive the care they need in a culturally competent and appropriate way. Now, these days, I was saying to somebody the other day, almost any meeting I'm in turns, no matter what the topic is, turns into a discussion of health human resources. We have mission-critical shortages in health human resources across the entire country and across the entire health care sector. And it's going to take many, many different types of solutions to address that problem. The reality is, at the same time that we have staffing shortages, we also have a whole lot of newcomers that have skills and expertise as healthcare professionals, but are unable to practice and are unable to contribute those talents and skills to organizations like CHEO and others that need the help, that need the talent, that need their skill. And so we are very excited about this renewal funding because it allows us to build on the past success of the N4 network and to work on this pressing problem in our healthcare system to really take this resource we have in our communities across the country and deploy them to care for other Canadians. And so it's really my great pleasure now to introduce CHEO's Manager of Health Equity and Diversity, Christine Curry, to talk to you a little bit more about the details of the program. Christine.
Thank you, Alex. Merci. Bienvenue à tout le monde. Merci, Marie Lalonde. N4 started as a dream when I was working hard to support those Syrian refugees and thought, other people must be struggling like me, right? I'm reinventing wheels, I just sense it. And so we started and got funding for this program, N4, to be able to say, let's work together, let's not reinvent wheels. There's economies of efforts here, let's all work together. And my colleagues across Canada, whether they were in healthcare or the settlement sector or social services, said, count me in. There's such passion around health equity across Canada that it was an easy sell. And so we were so pleased to see such a grand movement of membership. We have close to 1,000 members that have said, sign me up, I'm here to help, and let's make newcomers more welcome and support health equity for them, because their well-being is our well-being and we can do better. So part of our programming at N4, we have this platform where we share resources. So if I have an Arabic pain scale, why would you develop it? Here it is. We share education. We say, hey, I tried this and it worked or it didn't work. Here, use my information, use my learnings. We also brought together working groups of folks who said, you know what? We can't do this amongst what we're sharing. This is a new problem that we can't address. Can we sit down and work on this together? And so we had working groups, and we did develop that Afghan toolkit. It's ready, Minister Lalonde. It's online. And so anybody across Canada can go on there and get the tools they need, all the resources in one spot. We also have one for our Ukrainian evacuees that we're welcoming in Canada. And we also, as Minister Lalonde talked about, we have a position paper so those children don't feel like they need to translate for their parents. That's an added stress that children encounter, and it's not good for their mental health. So we have a position paper so people know, why do we do that, what are the alternatives, and how can we fund that economically. So we're really thrilled to get this funding because those working groups were so successful. We brought members across Canada. Within 3 months, we got that done. There was no grant applications needed and waiting period. We just got to work, rolled up our sleeves, and had these great products. So we're really excited to bring that model to this issue of newcomers who are physicians, nurses, physiotherapists, occupational therapists, all the folks we would love to hire at CHEO, but just have those barriers to be able to understand, how do I get my certification? Where can I get mentorship? What are the cultural elements around caring for children and parents and adults across Canada, so I understand consent laws and privacy expectations, interpersonal relationships, and so forth. So we can't wait to get together. We know there's been some great foundational work by this regulatory bodies across Canada, but health is provincially funded, so they're working in silos. We're going to bring them together, roll up our sleeves together, and get some real functioning work done so they can actually get to the bedsides in Canada. We're also partnering, again, with an education for those newcomers who are health professionals, so they can sit down and in a formal education way, not only informal, but formally get that education. And so we're really proud. We had an educational program for health professionals who were not newcomers to learn how to serve newcomers. And now we're expanding that with our great educational partners, St. Paul University, who are really experts in social justice. They live this, they breathe it, and we feel their passion every day when we talk to them. And so c'est avec plaisir que je vous présente Dr. Chantal Beauvais, rectrice de l'Université de Saint Paul, qui va vous parler à propos de l'éducation. Merci.
My mask always gets stuck in my glasses. Bonjour tout le monde, bonjour Madame Lalonde, Monsieur McGinty, Monsieur Yassir Nakvi, Madame Khoury, Madame Zoni, Alec. C'est un plaisir pour moi d'être ici ce matin. L'Université Saint-Paul est heureuse de se lier encore une fois avec l'hôpital pour enfants de l'Est de l'Ontario pour la création d'une offre de programme qui répond à un réel besoin dans notre communauté. At St. Paul University, our vision is to drive change and build a stronger, more inclusive and more diverse society. And this new initiative will help us do this. At SPU, we realize our vision in a bilingual environment through our distinctive programs, training, and our commitment to being a hub founded on the values of social justice and innovation. Every day, we strive to live up to these fundamental values with partners like CHEO and N4. Together, we make a difference. 3 years ago, we collaborated with CHEO and N4 to co-design and deliver an online program to a diverse group of professionals from across Canada. Professionals who assist newcomers in navigating the complex Canadian healthcare and social service systems. In concert, we provided opportunities for professional development, education, virtual discussions, networking, and the sharing of resources. In so doing, helped to identify and promote best practices. Michael told me I should put my sheets in the binder so they wouldn't fly with the wind. I disobeyed. Moreover, we did this during a pandemic. I applaud the commitment of the students and the incredible work of both N4 and SPU teams. Our goals was to equip the professionals with the tools and knowledge that would lead to improving the newcomers' experience when immigrating to Canada. We are so very proud of the incredible success of this initiative. Once again, we will collaborate with CHEO and N4 to develop new approaches to real problems, the shortages in the healthcare labor market. Together, we will develop and deliver training modules that will address key barriers to skills and labor shortages. Together, we will support internationally educated healthcare professionals and help them to integrate into the labor market. I look forward to the success of this project as well as the many more to come. A few years ago, I remember meeting this amazing person from CHEO who had a dream and was looking for an educational partner to help make it happen. I remember the look of surprise and the smile on her face when, after a few minutes of discussion, I said, yes, we can do this together. It is my privilege today to invite Zahar Zoni to the podium. Zahar is the manager of the N4 CHEO. She has a master's and a doctorate degree in pediatrics from Alexandra University in Egypt and a Master of Health Administration from the Telfer School of Management of the University of Ottawa. Dr. Zoni brings to the role over 25 years of work as a clinician, lecturer, researcher, and passion for quality improvement. She also managed 2 highly intense units, pediatric intensive care and renal unit. She has led many quality improvement projects along her years of practice, which she brought to CHEO in roles of quality improvement and patient experience, including building the hospital's participation in the Solutions for Patient Safety program, and a learning federal grant to develop a new newcomer navigator toolkit.
Take off my mask. Wow. Thanks a lot, Chantal, and thank you, everybody. This is really, I think Chantal said it all about me. So I'm the lived experience today, right? So over the years, Canada has been welcoming thousands of highly professional and skilled immigrants, including the international medical graduates, just like myself. So I migrated to Canada 9 years ago, and I can't believe I'm saying 9 years ago. And it just feels like yesterday. And I did come to Canada with 25 years of experience, as Chantal shared with you, in pediatric nephrology. And years of experience also teaching pediatrics to undergrad and postgrads, and lots of research work. So I was really very privileged to come to Canada, and I thought I would be able to persuade my life as a physician. But at the end, there were lots of challenges and barriers, just like many others who are out there, just like myself. So, so even though Canada has experienced like a shortage in physicians for over a decade now, which of course has recently, as everybody has shared with you, been a challenge, right, for the healthcare sector. As Alex shared, it's really shortages that have never been foreseen before. But still, 10% only of IMGs get to, who are the international medical graduates, they become licensed in Canada. So 90% are not licensed. And they come and they have years of experience. I'm just like, I'm talking about fresh grads, I'm talking about specialists with years and years of experience. So 90% do not. So the funding which is announced today, and thanks to IRCC for that, will allow us to work closely with our N4 partners that we have formed over the last 3 years. We can proudly say we have traveled from coast to coast across Canada. We have now partners from across the country, and we will be working very closely with them, together with the Canadian Medical Association, the Canadian Nursing Association, and the College of Family Physicians, who have recently, just in May, they have advised the House of Commons, the Committee of Health Committee there, about their need for policy changes. One of the recommendations was actually to integrate the internationally educated healthcare professionals to overcome the shortages in healthcare. So we will be working with them on one of those pillars of their 6 recommendations that they have made. We also look forward to bringing in-depth account of IMGs just like myself and their experiences. And we've already started integrating the lived experience from cost to cost. We're hoping by bringing that experience that we can aid decision and policy makers in better addressing the needs of the IMGs. And this could help various government bodies to identify the areas of improvement with regards the licensing and the attainment of the internationally integrated healthcare professionals. Ensuring that internationally educated healthcare professionals like myself are actually able to practice their profession in Canada is important. And this is not only to address the labor shortage, which is, again, a huge and major issue, of course, and improve the patient care, but also to demonstrate Canada's commitment to fairness, to equity, and to transparency for all individuals, including the newcomers. I would like to take this opportunity to express my sincere gratitude to IRCC, to MP Yasser Naqvi and David McGinty today for coming. Thank you very much. You've been a huge support to N4 since it was just an idea. Thank you very much for the support. My sincere gratitude to Alex Munter and to the CHEO team, because their unique, honestly, support from everybody has been amazing as we started this journey way back when we launched Simplifying the Journey. I would also like to express my gratitude to St. Paul University. As Chantal said, it was a dream, and I had knocked on so many doors, so many universities, and Chantal was like, yeah, it took her 5 minutes, honestly, with Michael and Pauline to just say, yes, we're taking this on 4 years ago now, maybe more than that. So thank you very much for your belief in the ability to create N4, and today to also work with the internationally educated healthcare professionals. I would like to recognize N4 team. Thank you, N4 team, for all your hard work from the heart. And you're such a highly motivated team that has got us where we are since the creation of N4, and now embarking on taking this new project, that hopefully we will be able to work with national partners across the country, and with your work and the continuous support of everybody that has supported us all our journey. Thank you very much. Thank you. Thanks.
Merci. Donc, le moment est venu pour les questions des médias. Media questions. Do we have any remote questions?
Je pense qu'on va passer aux questions ici en
Okay.
commençant. Et we're going to start here to begin, and we'll start with the Ottawa Citizen. Tom, you're welcome to use that microphone if you like.
Hi, Tom Desermo, Ottawa Citizen. Does the N4 program receive any kind of provincial funding as well as this?
No.
No. And could you just speak to how the N4 program works within CHEO specifically, like how many workers you have and stuff like that?
So I'll ask, where is she? Christine Coury is the manager of Health Equity and Diversity, just to describe a little bit. The program started as a frontline clinical program to respond to the needs of kids here, and then really grew with thanks to the support from the federal government to be turned into a national network. So maybe, Christine, you can talk a little bit about the details.
Thank you.
Yeah, thank you. So we have a small but mighty team of we're 10, soon to be 12 with this funding. We're adding to our team. We support the professionals, those subject matter experts across Canada to come together. So they don't feel like this is sided desks, all those things you really want to do but you never get to because I'm a busy physician, nurse, occupational therapist, settlement worker, etc. So that's our job, is to bring them together and really facilitate. So we have project coordinators, we have researchers, so they'll go and do the research for them, find the great data and bring it together. So we're really hopefully that glue and that support that brings them together. So that's our model. Yeah.
OK, on va continuer ici à Ottawa avec Inès.
Bonjour, Inès Lombardo de Franco-Presse. Ma question est pour Madame Lalonde. Je souhaitais savoir si l'annonce d'aujourd'hui allait concerner les nouveaux arrivants, les étudiants, notamment du volet direct pour les études. Parce que pour l'instant, je ne sais pas si c'est le cas. Je n'ai pas pu remplir.
Pas de problème. Je vous remercie beaucoup pour la question. Écoutez, aujourd'hui, on est ici pour parler d'un projet qui a été initié depuis 2019 par CHEO et ses partenaires pour vraiment combler et aider les gens dans le domaine de la santé à mieux connaître toutes les ressources et le côté académique. Et ça s'est développé au fil des années jusqu'à aujourd'hui, où on a vu avec tristesse l'ampleur de la pénurie de main-d'œuvre, particulièrement dans le domaine de la santé durant la pandémie, et aussi la reconnaissance des diplômes et comment on fait pour reconnaître et trouver une façon d'amener des gens à une table. Donc, le financement aujourd'hui est vraiment pointu pour permettre au groupe de N4 ici, avec leurs partenaires, de continuer d'élaborer des stratégies, aussi de travailler avec les familles qui arrivent ici et de développer avec tous les acteurs du Canada cette reconnaissance des diplômes. Au niveau des étudiants internationaux, je te dirais, écoutez, vous faites les études. Les étudiants internationaux, lorsqu'ils arrivent ici au Canada, font leurs études au Canada. Et comme vous le savez, durant la dernière année de 2021, il y a eu quand même des ouvertures pour que ces étudiants-là puissent continuer de cheminer aussi au Canada. Donc, aujourd'hui, c'est tout près d'1,5 million qui va reconnaître le travail des dernières années pour continuer encore d'aller plus loin avec l'ajout de 2 nouveaux membres du personnel.
Merci. Et je voulais aussi savoir, il y a un rapport qui a été émis d'ailleurs par le comité permanent de l'immigration. Vous en faites partie d'ailleurs.
Oui.
Donc, j'aimerais savoir si le ministre Fraser va écouter les recommandations et lesquelles de ce rapport.
Bien, écoutez, ce que je peux dire, c'est que c'est certain qu'on remercie le comité pour cet excellent rapport. Le gouvernement et le ministre Fraser va être très attentif aux recommandations. Puis c'est certain qu'au sein du ministère et de l'équipe de M. Fraser et du gouvernement du Canada, ça fait quand même plusieurs années, dont particulièrement les 2 dernières années que je vous faisais référence, de l'importance et de la plus-value de l'étudiant international qui vient ici, mais aussi des défis que certains d'entre eux ont et subis durant leur processus. Donc, on va toujours travailler en collaboration et c'est certain que le rapport va être considéré attentivement et vu attentivement.